have made a lot of progress to analyze the gut microbiota, and novel tools now allow to characterize the complete genes and genomes of all dominant microbes, basically. And this allows to characterize dysbiosis far better than we were able to do before. It allows, for example, to pinpoint specific genes that are present in patients compared to healthy individuals. And it allows also to reconstruct genomes of specific bacteria that are signatures of disease, and it allows to go all the way to functions of those microbes in specific disease conditions. Specific bacteria are identified when we compare patients and healthy individuals, for example, and we can even describe very precisely the genes and genomes of those bacteria. And for some strains we have this information already, so we know of strains that are bioactive in protecting from disease conditions and in helping to reduce aggravation of chronic disorders, for example. Some bacteria can be identified associated with disease or health, and we can go all the way to understand what function they exert, and we have good examples of that. I will take a few. Faecalibacterium prausnitzii is present in almost all healthy human gut microbiota, and we see it diminished or absent in certain patients, and we know that it's anti-inflammatory. And so we can think of using this specific commensal bacterium as a new treatment, for example, as a new probiotic. Now, talking of commensal bacteria is completely different from the usual probiotic concept that were essentially lactic acid bacteria and bifidobacteria. But I can predict that we will see in the coming 2 years, probably, human trials with commensal bacteria that are currently being prepared in capsules, for example, or sachet, and that could be very helpful to treat specific conditions. So there are four main outcomes that we can think of. Microbiome as a source of signatures, of diagnostic tools to associate with disease, but also to predict the outcome and the improvement. Microbiome for the second one as a source of new drugs and drug targets. And we now can explore the complete genetic makeup of the gut microbiota, looking for especially signals that microbes send to human cells that can be new drugs. Microbiome as a source of indication for modulation. We know that nutrition can modulate the microbiome, and recent data, for example, indicate that specific fibers and mixes of fibers can be very helpful to modulate diversity of the gut microbiota. And finally, microbiome as a treatment of its own. And we see specific gut microbes that can be helpful, but also complete microbiota can be used in fecal microbiota transplantation, and it's being developed quite a lot today.